major aspects of our institute's work is to provide high quality comprehensive eye care to people living in the remote rural areas and tribal areas. To meet this need, we started developing models, and we started about 19 years ago with creating secondary level eye care centers, starting first in a village called Mudol in Adilabad district. These centers are intended to cover a population of about 5 lakh people and to provide comprehensive eye health coverage. So prevention programs, treatment of disease, all medical treatment, and some aspects of surgical care up to secondary level. And then rehabilitation of people who are irreversibly blind in those communities. So we have been doing that for the past nearly 18 years. And over these 18 years, developed 11 centers, secondary centers across Andhra Pradesh. And a few years after that, not feeling happy with our reach even with those secondary centers, we went to the remotest rural areas and tribal areas with a model of primary eye care called vision centers, each covering a population of 50,000 people, employing a trained technician, somebody who is selected from the local community, trained and put back in their own communities most of the time. So that is the philosophy. The idea is that anybody from those villages should be able to walk off the street and get their eyes screened free of cost. This is to provide that coverage, make sure that nobody goes needlessly blind in those communities, and to also, to some degree, inculcate a habit of seeking health care in those rural communities. And till date, we have covered about 5 lakh people through this program. So why we have invited you today is to announce our celebration because we are going to inaugurate our 100th primary eye care vision center in the village of Araku in Visakhapatnam district. So with that, we would have been covering 2,000 villages nearly in Andhra Pradesh, covering a population of 50 lakh people with universal eye health coverage. We create models all over India. We can't cover all of India. We know our limitations. We are only a small institute. Covering the whole of the country is always government's responsibility.